Hello. Today, we'll discuss treatment of the most common sports injuries. Whether you're an adolescent, teenager, or adult, sometimes doing activities or exercise programs can lead to athletic injuries. It is important to recognize an injury and apply some basic steps on how to treat the injury. A musculoskeletal injury is any insult to a muscle, bone, tendon, or ligament that can cause inflammatory process and decrease in its normal physiological function. It is commonly characterized by swelling, inflammation, including discoloration or temperature changes within the skin, pain, or difficulty with ambulation or daily activities. Most muscle strains, ligament sprains, joint bursitis, and bone contusions can be treated with a simple mnemonic called R.I.C.E. R is for rest. If you are unable to walk, run, or bike ride, a person needs a period of time where they are not participating in any of their normal sports activities or exercise programs. It is important not to continue with your exercise if you are hurt. I is for ice. It is recommended that a person ices for 20 minutes about 3 to 4 times per day while swelling is present. Ice is best because it acts as an analgesic for pain and causes vasoconstriction of blood vessels. This leads to decreased swelling and inflammation in soft tissues. Some people make the mistake to use heat with acute injuries, but this is not correct, as it does not have an analgesic effect and can cause vasodilation, leading to prolonged swelling and inflammation. C is for compression. Everyone has probably used an ACE drop at some time in their life, and it's used to compress the swollen area and provide support to an injured structure. E is for elevation. Elevation is helpful for encouraging our lymphatic system to disperse fluid into different spaces within the body and carry away inflammatory toxins. It is recommended that a person elevate as much as possible. In many occasions, a brace, walking boot, or crutches are used to aid in ambulation or mobilize a joint. These all can be very helpful in healing of your injury. Of course, depending on the mechanism of injury and past medical history of a patient, it is important to consider imaging studies like X-ray, CAT scan, MRI, or bone scan. These studies can also be helpful with the diagnosis confirmation and progression of an injury. Most important, if you think you're injured, please visit your primary care physician for evaluation and treatment to get you back loving life and participating in your normal exercise activity. For more information and a clinical evaluation, please go to sdsm.com.